1 in 3 adults on this planet is constipated, not occasionally, chronically. And the part that should alarm you is this: 90% of those people walk into a pharmacy, grab something off the shelf, and leave with a product that is actively destroying the one organ they're trying to fix. They pay money to cause permanent damage to their own intestine. I've spent 15 years watching this play out in exam rooms, and I'm done staying quiet about it. Subscribe to Dr. Waterling and hit like. We're building toward 1,000 subscribers, and I need your help to get there. Here's the truth: nobody at your next appointment is going to hand you. The system doesn't profit from your recovery. It profits from your return visits. I'm here to change that. Let's start with the thing most people do first, and the thing that causes the most long-term harm. When your gut stops moving, the instinct is to go to the drugstore, and the first thing you see on the shelf is something made from senna leaves. Different brand name, same formula. It's sold without a prescription, it's cheap, and the label says plant-based, so it feels safe. That's the trap. That natural label is doing a lot of work to hide a very ugly mechanism. Senna leaves contain compounds called anthraquinone glycosides, anthroglycosides for short. These are chemical compounds that, once they reach your large intestine, convert into their active form and begin aggressively irritating the nerve receptors in the wall of the colon. The colon responds with a violent spasm and pushes everything out. You feel relieved, you think it worked. But now, let me tell you what happens after that. Your gut has its own nervous system, the enteric nervous system, and it behaves exactly like any other nervous system. It adapts. Hit it with the same irritant signal over and over, and it stops responding. The receptors literally burn out. Their sensitivity drops. The nerve fibers running through the wall of the colon thin out and degenerate. This is not an abstraction. These are measurable, visible, structural changes. Under a microscope, you can see them. This condition has a clinical name, cathartic colon, also known as melanosis coli. Melanosis means the wall of your colon physically darkens, turns brown, sometimes nearly black, because the cells of the lining are dying in large numbers and depositing pigment as they die. A gastroenterologist doing a colonoscopy on someone who has used senna chronically will see a colon that looks like a dark, scorched pipe. Those changes are irreversible. That colon doesn't come back. Here is what the progression looks like in a real patient. Week 1, 1 senna tablet works fine. Week 3, it takes 2. Week 6, 3 tablets. Month 3, nothing works without senna at all. The bowel has lost the ability to move on its own. The patient came in with occasional constipation and left with a permanent dependency on a laxative and irreversible organ damage. That is not a side effect. That is the predictable, documented outcome of regular senna use. I never, and I mean never, recommend senna-based laxatives. Not once, not as a short-term fix, not in an emergency. There is no clinical scenario where destroying your bowel's nerve supply is the right answer. So let's talk about what actually works, and I mean works physiologically, not just empties you out once, but restores real function. What we need is something that does 4 things at once: gently stimulates peristalsis, coats and protects the lining of the gut, feeds the beneficial bacteria that live in your colon, and provides direct energy to the cells of the intestinal wall itself. Peristalsis, by the way, is the wave-like muscular contraction that moves food through your digestive tract from your stomach to the exit. When those waves slow down or lose coordination, you get constipation. Simple as that. The answer is flaxseed, 2-TBSP. And before you click away, because you've heard this before, stay with me, because the way most people use flaxseed is completely wrong. And the wrong method gives you almost none of the benefit. Flaxseed contains protein, fat, carbohydrates, and 2 distinct types of fiber. Soluble fiber is the type that, when it contacts water, forms a gel, a thick, viscous, mucus-like substance. That gel is the active ingredient here. Insoluble fiber is the type that doesn't dissolve. It physically contacts the wall of the colon, providing a gentle mechanical massage that triggers muscle contractions. Together, these 2 fibers create a slow, steady, physiologically normal movement of intestinal contents. No spasm, no violence, no nerve damage, just normal motility. That's the medical word for how well and how regularly your gut moves. But here is where people go wrong. They eat the seeds dry. Dry flax seeds are hard, poorly digested, and can actually scratch the mucosal lining, the soft inner surface of your gut. You need to soak them. Here is the exact protocol. Take 2 TBSP of whole flax seeds, cover them generously with room temperature water. Leave them overnight, a minimum of 8 to 10 hours. If you plan to soak them longer than 24 hours, put the bowl in the refrigerator. At room temperature, beyond that window, the seeds begin to ferment, and instead of healing your gut, you will irritate it. What happens during soaking is this: the outer shell of the seed softens, and soluble fiber begins to leach out into the water, forming a thick gel around each seed. That gel is the therapeutic agent. It coats the mucosal lining from your stomach all the way to your colon. If you have gastritis, inflammation of the stomach lining, this gel reduces irritation and supports healing. If you have inflammation further down in the bowel, same effect. And physically, it creates a slick, lubricated environment that allows the intestinal contents to move far more easily. Critical point after soaking: do not rinse the flax seeds. The liquid they soaked in is loaded with soluble fiber and active compounds. If you pour that liquid down the drain, you just threw away the most valuable part. Use the seeds and all the soaking liquid together. Now add sesame seeds, also soaked overnight. Sesame is rich in calcium, and that's clinically relevant, not just nutritionally interesting. Calcium is directly involved in the contraction of muscle cells, including the smooth muscle cells in the wall of your intestine. Without adequate calcium, those cells contract poorly. Sesame also contains zinc, vitamin E, and polyunsaturated fatty acids, all of which support the integrity of the intestinal lining. Unlike flaxseed, sesame can be rinsed through a fine strainer after soaking just to remove any surface debris. Put the soaked flax seeds with all their liquid and the rinsed sesame seeds into a blender. Now you start adding. Here's what goes in and exactly why each ingredient is there. Berries, any kind: blueberries, raspberries, strawberries, black currants. Berries contain pectin, which is another form of soluble fiber with a well-documented anti-inflammatory effect on the intestinal lining. They also contain anthocyanins. Those are the pigments that give berries their deep color, and anthocyanins are potent antioxidants that protect the mucosal cells of the gut from oxidative damage. Prunes, 3 or 4. The laxative effect of prunes has been known for thousands of years, and modern science has finally caught up with the explanation. Prunes contain sorbitol, a natural sugar alcohol that draws water into the lumen of the intestine, the inner space where the stool sits. More water in that space means softer, more mobile stool. Prunes also contain chlorogenic acids, compounds that have been shown to directly stimulate peristalsis. 3 or 4 prunes in this smoothie make a measurable difference. Banana, ripe or slightly underripe, each has its benefits. Banana provides sweetness and, critically, potassium. Potassium is an essential mineral for muscle function, including the smooth muscle of the intestinal wall. Low potassium slows peristalsis. An underripe banana also contains resistant starch, a type of carbohydrate that your small intestine cannot digest, so it passes intact to your colon and feeds the beneficial bacteria living there, improving your gut microbiome. A ripe banana provides faster energy and has a gentler effect on blood sugar. Fresh greens, parsley, dill, cilantro, spinach, whatever you have. Greens supply chlorophyll, folate, vitamin K, and magnesium. Magnesium is something I want to spend a moment on because most people don't understand what it actually does in the gut. Magnesium relaxes smooth muscle. That sounds counterintuitive for a constipation treatment. Shouldn't you want the muscle to contract? Here's the key. A significant portion of constipation is the colon isn't sluggish. It's overcontracted, squeezing chaotically without producing useful forward movement. Magnesium normalizes that rhythm. It resolves the spasm and restores coordinated productive contractions. On top of that, magnesium draws water osmotically into the intestinal lumen, softening the stool from the inside. Spices, turmeric first. Turmeric contains curcumin, one of the most extensively studied natural anti-inflammatory compounds in existence. Over 3,000 peer-reviewed scientific publications have examined curcumin's effects on the gastrointestinal tract. The findings are consistent. Curcumin reduces mucosal inflammation, relieves intestinal spasm, and improves bile flow. Bile is the digestive fluid your liver produces and your gallbladder stores. And bile directly stimulates intestinal motility. More bile flow means better peristalsis. Cinnamon improves insulin sensitivity at the cellular level, reduces bloating, and has a mild antispasmodic effect. Cardamom has been used for digestive disorders across multiple traditional medical systems, and modern research supports it. It relieves nausea, stimulates the secretion of digestive enzymes, and reduces intestinal cramping. If you don't have flaxseed on hand, chia seeds are a valid substitute. The mechanism is similar. When soaked, chia seeds form a dense gel. They're rich in omega-3 fatty acids and soluble fiber. Chia soaks faster. About 30 minutes is enough. Once everything is in the blender, add a small amount of hot water. This is not optional, it's physiological. Cold food and cold liquids slow the movement of the gastrointestinal tract. This is a direct effect of temperature on smooth muscle function. Warm food accelerates it. You want the finished smoothie to be warm, not cold. Blend everything until smooth. Then at the very end, add 1 to 2 TBSP of cold-pressed vegetable oil. Oil serves two functions here. It lubricates the intestinal wall from the inside, reducing resistance to the movement of stool, and it dramatically improves the absorption of fat-soluble vitamins A, D, E, and K from the greens and berries. Without fat present in the same meal, these vitamins are not absorbed. They pass through unused. Now, I need to say something about the packaged fiber products sold in pharmacies and supermarkets, the ones in bags labeled fiber supplement or wheat bran for constipation. Here is what those products actually are: dry, hard particles that have not been soaked and have not formed a gel. Dry bran does not have the protective mucilage that soaked flaxseed produces. It is abrasive. And in a colon that is already moving slowly with insufficient water content, dry fiber particles don't slide through. They adhere to the intestinal wall. They can sit there for an extended period. Instead of stimulating peristalsis, they create additional resistance and slow things down further. The effect is directly opposite to what the packaging promises. Soaked whole seeds only. No dry powders in a bag. When do you take this smoothie? In the morning, after you've already had water. And I want to talk about water next because without it, everything else I've described works at half capacity. Constipation and dehydration are almost always the same story, presenting in different ways. Here is the mechanism. As food moves through your large intestine, the colon actively absorbs water from the contents. That's a normal physiological process. But when you are chronically underhydrated, your body shifts into conservation mode. The colon pulls even more water than usual from the intestinal contents, leaving behind something dry, dense, and immobile. The stool physically adheres to the intestinal wall. That is the mechanism of dehydration-driven constipation, and it is extremely common. The fix starts the moment you wake up. Before coffee, before food, before anything, you drink half a liter of warm water slowly, not in one gulp. Your stomach and intestine need time to receive it. Warm water activates the gastrocolic reflex. That's an involuntary reflex, meaning it happens automatically without conscious thought, where the filling of the stomach sends a nerve signal to the large intestine to begin strong peristaltic contractions and prepare for evacuation. This is why many people feel the urge to use the bathroom shortly after their morning coffee. It is not the caffeine. It is the warm liquid triggering the gastrocolic reflex. We use exactly the same mechanism, just without the caffeine and the gastric acid stimulation that coffee causes. Let's talk about mineral water, because not all mineral water does the same thing. The key variable is total dissolved mineral content, also called mineralization. To have a real therapeutic effect on constipation, water needs a mineralization of at least 4 g per liter. Waters in that range are classified as medicinal or medicinal table waters. They work osmotically, meaning the dissolved salts in the water attract fluid into the intestinal lumen, physically softening the stool from the inside. Essentia number 4 is a good example of a low to moderate medicinal water. Essentia number 17 has higher mineralization and a more pronounced effect. Magnesium-rich mineral waters deserve special attention. As I explained with dietary magnesium, the magnesium in water relaxes intestinal spasm and draws fluid into the colon. Both mechanisms work simultaneously. If you can find a high magnesium mineral water at your local store, look for it specifically. Check the label for listed magnesium content. One non-negotiable rule about packaging: buy mineral water in glass bottles only. This is not an environmental preference. This is chemistry. Plastic releases microparticles and chemical compounds, bisphenol A phthalates, and related substances when it contacts liquid. Saline mineral water is more chemically aggressive than plain water and leaches these substances from plastic more intensively. Research published in recent years has detected microplastic particles in human blood, in lung tissue, and in the placentas of pregnant women. According to data from multiple scientific publications, the average human body has now accumulated enough microplastic to manufacture a plastic credit card. Glass is chemically inert. It does not interact with what is stored in it. Glass only. Before drinking, dégage the water. Open the bottle, pour it into a glass, and let it sit for a few minutes. Stir with a spoon. The carbonation dissipates. This matters because carbonated water in an already slow intestine produces gas, bloating, and pain. You do not need additional gas load on a gut that is already underperforming. Drink it warm and flat. One important caution: high mineralization medicinal water is a therapeutic agent, not a daily beverage in large quantities. Sustained high intake puts a significant salt load on your kidneys and your cardiovascular system. If you have hypertension, that is high blood pressure, or any kidney condition, this is especially relevant. 1 to 2 glasses on an empty stomach in the morning during an active episode of constipation is a reasonable therapeutic dose. For everyday hydration, use regular drinking water or a low mineralization water under 1 g per liter. Here is what to expect when you run this protocol. The effect is cumulative. Build that expectation in from day 1. Do not wait for something dramatic on the first morning. By day 2 or 3, the heaviness and bloating sitting in your abdomen will begin to ease. Any abdominal discomfort or cramping will reduce or resolve. By day 4 or 5, the bowel starts moving actively. In some patients, the initial response is impressively thorough. The body begins clearing what has accumulated over days or weeks. That is not a problem. That is the expected healthy physiological response of an organ that has finally been given what it needs to work properly. Here is something worth knowing about how age changes all of this. After the age of 45, intestinal motility naturally slows down. Digestive enzyme production decreases. The sensitivity of nerve receptors in the intestinal wall diminishes. The volume of protective mucus produced by the intestinal lining drops. These are normal changes of aging, not disease. Just biology, but they mean that what resolves in 2 days for a 30-year-old may require a more systematic, sustained approach for someone in their 50s or 60s. The protocol I've described works at every age, but the timeline and the consistency required differ. How old are you? Write it in the comments below. I want to know which age groups are watching, because the next videos I make on digestive health will be built around where you actually are, not around some hypothetical average patient. So here is exactly what you do after you finish watching. Tonight, take 2 TBSP of whole flax seeds and cover them with room temperature water. If you have sesame seeds, soak those separately. Leave them minimum 8 to 10 hours. If you have senna-based laxatives in your home, remove them from the cabinet. They damage the nerve supply of your colon with repeated use and create a dependency that is very difficult to reverse. That is not an opinion. That is documented pathology with a clinical name. Tomorrow morning, drink half a liter of warm water, first slowly, then make the smoothie. Soaked flaxseed with all its soaking liquid. Sesame after a quick rinse, whatever berries you have, 3 or 4 prunes, a banana, a handful of fresh greens, turmeric and cinnamon at minimum, a splash of hot water to make it warm, and 1 to 2 TSP of cold pressed oil at the very end. Blend it smooth. If you want to strengthen the effect, add a glass of warm, degassed, high mineralization mineral water, 4G per liter and above from a glass bottle on an empty stomach before the smoothie. Run this for 5 to 7 consecutive days. Your bowel will respond. Your doctor has 12 minutes with you at an appointment. There is no billing code for teaching you how to fix constipation with flaxseed and mineral water. The system isn't structured for that conversation. I am. Subscribe to Dr. Waterling and hit like. We're pushing toward 1,000 subscribers and every single one counts. Nobody in a clinic is going to sit down and walk you through this. There is no financial incentive to keep you out of the pharmacy. I'm Sam Waterling, and I've spent 15 years watching people pay for damage they didn't need to take. Not on this channel.